Good afternoon, everyone. Thank you so much for joining us for our annual enrollment presentation. We're thrilled that you're taking the time to visit with us for a bit this afternoon. My name is Mary Lockenbrook. I am the Executive Director of Benefits for the Montana University System, and I have my team here with me as we present to you what you can anticipate as we walk through the annual enrollment for fiscal year 25. If you have questions during the presentation, please don't hesitate to go ahead and type them out, and we have staff members here who will respond to you as we're going through the presentation. So on behalf of Commissioner Christian and our entire team here in Benefits at the Commissioner's Office, welcome to Annual Enrollment for Choices for fiscal year 25. You know that will run from July 1, 2024 through June 30 of 2025. In our agenda today, we'll talk a bit about annual enrollment. We'll discuss our medical plan benefits, prescription drug benefits, the dental plan benefits, our vision hardware benefit. We do have some provider network reminders. We'll discuss wellness programs and premium payments. So first, let's talk about the dates. Our annual enrollment this year will open on April 24th, so that's this Wednesday, and run through May 15th of 2024. So for retirees during the annual enrollment period, if you want to make any changes, you must submit your retiree enrollment form with those changes to your campus benefit representative no later than end of business on May 15th, 2024. You need to contact your campus benefits rep to request a retiree enrollment form only if you are making changes to your current benefit elections. If you do not want to change anything, you just want what you have today, do not submit changes and you will automatically be re-enrolled in the current year's benefit elections. Your retiree benefit workbooks are on the way to you. They were mailed out the week of April 15th, and they are actually available on our Choices website now. The recorded presentation from today, the slides will be available on the Choices website by April 24th when your enrollment period opens. So first we wanted to give you a little look back into history, just because I think it's important to kind of look at where we've come from and then talk about where we're headed. With regard to your medical plan, there have been no premium changes since fiscal year 20. Dental plan, no premium changes since fiscal year 14. Vision hardware plan, no premium changes since fiscal year 20, and no adverse benefit changes since fiscal year 20. We have only enhanced your benefits. And I'm thrilled to tell you that we will head into fiscal year 25 with no benefit changes and no premium increases. So it's really unheard of in the world of benefits to be able to offer a valuable benefits package without having premium increases year over year. We've heard from many retirees who have been very appreciative. I'm appreciative of my staff that works really hard to make sure that we can give you the best value of benefits that we can for what you're paying. And I also would give a shout out to our inter-unit benefits committee as they work very diligently and collaboratively to ensure that we can offer the best value of benefits at the most reasonable price possible. So we are really proud to tell you that, again, for fiscal year 25, so July 1 of 24 through June 30 of 25, there will be no increases in premiums and no benefit changes. Just one side note on that topic, it's pretty unheard of in the industry. Most plans have had brutal double-digit increases over the last 2 years. And just across the industry in general, it's ranged from 6% to 30% year over year. So most plans don't go any years without some type of premium increase and or negative benefit changes like increases to deductibles and coinsurance and copays, those kinds of things. So we're really thrilled that we're able to offer you another year of status quo in terms of no premium increases. So let's talk a bit about the retiree medical plan benefits. Again, there will be no changes. So the office visit copay will remain at $30, specialist office visits at $50, the in-network deductible at $1,250 per individual or $2,500 per family. The in-network out-of-pocket maximum will remain at $4,350 per individual or $8,700 per family. After the deductible is met, the plan will reimburse at 70% of the allowed, and you will have a 30% coinsurance for in-network services. And after the out-of-pocket maximum is met, the plan pays 100% of allowable for in-network services. Your eye exams, whether routine or medical, the first one per plan year, will process on the medical plan, and there will be a $0 copay. We do have one update to your medical plan, and that is with regard to the network for hearing exams. And this current fiscal year, we're processing all audiologist hearing exams on the in-network benefit because there was not an adequate network. But Blue Cross Blue Shield has worked diligently throughout this past year, and there is now a very extensive network of audiologists. So as of July 1, 2024, audiologist exams will be processed based on the network status of the provider. So that just means that you do want to look for an in-network provider for your hearing exam. There is one hearing exam per plan year at $0 copay with an in-network provider. Additional in-network hearing exams are subject to the in-network office visit copay. And hearing exams billed by out-of-network providers will now be subject to the out-of-network benefits, which would be the out-of-network deductible and coinsurance, which are separate from the in-network deductible and coinsurance. An update from Blue Cross Blue Shield of Montana. They have changed their mailing address for claims processing. They have indicated that it will involve faster processing and response time for members. So as of immediately, really, you should begin using the Blue Cross and Blue Shield of Montana address in Dallas, Texas. But there will be a one-year transition period, and after that 1 year is up, the Montana post office boxes will be closed. At the end of June, Blue Cross Blue Shield of Montana will send new medical and vision hardware ID cards, if you happen to have vision hardware, with the new claims mailing address to all of our Montana University System plan members. So you can watch for those ID cards late June to early July. On to our prescription drug plan benefits. Again, no changes here. Navitus will continue to be our pharmacy benefit manager. We will continue to offer Tier 0 for a few select preventive medications. Those have a $0 copay. Tier 1 will continue to have a $15 copay for a 1-month supply or a $30 copay for a 3-month supply. Tier 2 will have a $50 copay for a 1-month supply or a $100 copay for a 3-month supply. Tier 3 will have a 50% coinsurance, and that does not apply to the out-of-pocket maximum. And Tier 4, which is our specialty medications, will continue to have a $200 copay if they are purchased at Lumicera Specialty Pharmacy, or a 50% coinsurance that does not apply to the out-of-pocket maximum if they are purchased at retail. So again, Lumicera Health Services will be our specialty pharmacy. So it is important that you work with Lumicera for your specialty medications to ensure that you have that $200 copay rather than a 50% coinsurance. Western Drug in Bozeman, CVS, and Target continue to be non-participating pharmacies for our non-Medicare retirees. Medicare requires an open network, which means those pharmacies would be available to our Medicare primary enrollees. You can also fill your prescriptions at a participating retail pharmacy for either a 1-month or a 3-month supply. And mail order prescriptions can be filled for a 90-day supply at either Ridgeway or Costco pharmacy. A few prescription drug plan reminders. Medicare eligible retirees must be enrolled in both Medicare Parts A and B as your primary coverage. If you are Medicare eligible and not enrolled in both Medicare A and B, you will be disenrolled from the MUS Choices medical and prescription plans. So that's really important to maintain your enrollment in both Medicare Parts A and B. Medicare eligible retirees enrolled in the Choices Medical Plan will automatically be enrolled in the Navitus Medicare RX Part D prescription drug plan. Medicare primary retiree medical plan members cannot be enrolled on another Medicare primary retiree medical plan as a spouse due to CMS Medicare Part D rules. So we do have split family coverage for Medicare primary retirees. They're enrolled in the Medicare RX Part D plan, and any non-Medicare eligible retiree plan members are enrolled in our commercial plan through the university system. Medicare primary retirees are enrolled as individuals, not as a family. Again, we're working with the Medicare Part D rules. Medicare pharmacy plan benefit accumulations are calculated based on a calendar year, not our fiscal year. So that's just something that you have to keep in mind if you are Medicare primary. And that, again, is because that is what CMS, or the Centers for Medicare and Medicaid Services, require for Medicare primary enrollees on Part D coverage. Again, as required by Medicare, there will be an opt-out period, and it will run from October 12th to October 29th of 2024. If you opt out of Navitus as your Part D prescription drug coverage, or out of Navitus commercial plan if you're a pre-65 retiree, you will be disenrolled from the MUS Choices medical and RX plans. So those two go together for the Montana University system, so you can't take one and not the other. We'll move on now to retiree dental plan benefits. We will continue with Delta Dental as our third-party administrator for our dental plan. Retirees have the option of having the Select Dental Plan, which covers diagnostic and preventive, basic and major restorative dental services. It also provides a benefit for orthodontia that offers coverage for $1,500 per lifetime per covered plan member. There is a $2,000 annual benefit maximum per covered plan member, but that maximum does not apply to diagnostic or preventive services. So it's really important to us that you have the opportunity, even if you have some major services under your dental plan, that you still have the opportunity to have your teeth cleaned and an oral exam done twice per year. So let's just say you had an implant and a couple of crowns, and you've maxed out the $2,000 annual benefit. You would still be able to get your diagnostic and preventive services. So you could go ahead and have your cleaning and your oral exam done. We wanted to remind you that the Montana University system utilizes a fee schedule for reimbursement. What that means is we're not utilizing a network model. In a network model for dental benefits, your benefits would be based on the network status of a provider. So you would have in-network benefits and out-of-network benefits. And in-network benefits typically have a deductible first, and then they will pay a percentage of the allowable fee. And then out of network is a drastically reduced benefit. As you know, the Montana University system does not utilize a network model. And so we don't even have a deductible on any of our dental services. We actually have a fee schedule that is used to determine what the maximum reimbursement will be for a specified procedure code, regardless of the provider's network status. And this is really important for us to emphasize this year because many of you may be experiencing some disruption with your dental providers with regard to their affiliation or network status with Delta Dental. We are aware of what is happening with dental providers exiting the Delta Dental network, and I will tell you that the majority of the letters that I have seen from dental providers, they are not just leaving the Delta Dental network, they're leaving Blue Cross Blue Shield, they're leaving Cigna, they're leaving Aetna. They are going what is called insurance independent. And that, as providers, offers them a couple of advantages. One is that they can bill for charges in full in advance. And second, they can set whatever charge they would like to be paid for their services. This is not something that's new in the industry. It does tend to cycle. And when it does cycle into a time period when providers are leaving networks, it does seem to happen in groupings. And that is what we're experiencing right now. We've seen letters from providers in the Gallatin Valley, so the Bozeman service area, Missoula, Helena, and most recently Butte. So we are aware, we're staying close with our account team at Delta Dental, and they are working diligently with providers, trying to come to agreements to get some of the providers to re-enter the network. I don't have any idea when or how that may occur, so stay tuned for that, but do understand that your benefit is not based on the network status of the provider. We do have a set fee schedule. You can find that in your enrollment workbook, which is actually a consolidated listing, or in our summary plan description, there's a complete listing of all covered dental services and what the Montana University system fee schedule reimbursement is for each code. So you do have the freedom to choose any licensed dentist. Now, it is true that your out-of-pocket costs may be reduced if you're able to utilize a Delta Dental network dentist, because sometimes the amount they agree to take from Delta Dental is less than the university system's fee schedule allowance. So that is how that would work if you actually did see a reduction in your out-of-pocket costs by utilizing an in-network dentist. So let's move on to the Vision hardware plan benefits. Again, no changes to your premiums or to your benefit. If you choose to have Vision hardware, that will cover your eyeglass frames and prescription lenses in lieu of contacts, one pair or one purchase per covered plan member per year, up to an annual maximum of $300. Or you may choose prescription contacts in lieu of frames and lenses, one purchase per covered plan member per plan year with a $200 annual maximum reimbursement. Keep in mind your eye exam, regardless of whether it's routine or medical, is covered as part of your medical plan benefit, one per year, $0 copay for that first eye exam of the plan year when you're utilizing an in-network provider. And the Vision hardware plan covers hardware only, so that's frames and lenses or contacts. A few provider network reminders. Please always utilize in-network providers when you are able to do so. And on the medical plan side, it's really important because we do have a network model on the medical side of our benefits. And if you choose to use out-of-network providers, you can and most likely will receive balance billing for any difference between the provider's charge and the insurance allowable amount. And every year, We have somebody who tells us they understand this balance billing concept, but they still want to utilize an out-of-network provider for a myriad of reasons. You know, it's not always the same reason. But what is very unfortunate, actually two things. One is we are really at a disadvantage in assisting you and advocating for you with an out-of-network provider when you have already received the services and now have a bill. And the second unfortunate part of this situation is that oftentimes I'm not certain that people recognize how large balance billing can be. So somebody who says to us before they have services that they know it's an out-of-network provider and they still want to use them and they know they'll be balance billed and that's all okay, then may receive a bill, for example, for $15,000, which is the balance billing for the difference between the provider's charge and the insurance allowable amount. And then suddenly that is a very important issue to them because they didn't anticipate a balance billing of that amount. We have seen extremely large balance billing amounts. I actually saw one that was above $100,000. So please do your research, educate yourselves, call us if you need our help with advocating, with helping you navigate, whatever we might be able to do to help you prior to receiving services. Always check the status of your provider. Do not assume that because your doctor has always been in network, they are now. We are seeing some pretty wonky things happening with provider networks, and it's just really important that you double check that. You can always contact Blue Cross Blue Shield on the medical side or our office here, MUS Benefits at the Commissioner's office, if you need assistance finding in-network providers. And to check to see if your provider is an in-network provider, you can visit the Plan Claims Administrator's online provider finder. We've listed them for both Blue Cross Blue Shield and Delta Dental. Just keep in mind that we do not have a network model for our dental benefits. So you do have freedom of choice and you would want to check our fee schedule reimbursements. A few wellness program highlights. We do continue to offer 2 university system sponsored well checks each plan year. Retirees are invited and encouraged to attend. There are a certain number of lab work items that are covered by the plan at no cost to you. And then there is also the opportunity to add some items if you choose and pay them yourself when you attend the well check, and they are at a reduced cost to you. We offer our wellness incentive program via the Virgin Pulse platform. If you have not been on to check out that incentive program, I would encourage you to do so. You might find some of the opportunities pretty interesting for you. So I would definitely say check that out if you haven't already. We're excited to advise of our new MUS Wellness Lab. This is an online fitness, nutrition, and healthy habits video learning tool. All original content, and I think that you'll find that to be very useful if you have questions or would like some education on some of these topics. We continue for our non-Medicare retirees to offer the Take Control Lifestyle Management Program, and that is particularly valuable for those with conditions such as diabetes or prediabetes, hypertension, high cholesterol, weight management. We will also continue in fiscal year 25 to offer Wonder Health, Hinge Health, Well on Target, and the Blue Cross Blue Shield Blue 365 discount program. In addition, Delta Dental continues to offer our enrollees the opportunity to utilize their Amplifon and QualSight programs for hearing and eye surgery benefits. So the Wellness Incentive Program, this program runs on a calendar year. So the current program will run through December of 2024. It resets every quarter, so it just reset for April 1st. So if you're not participating, this is a great time to get on and jump in for the current quarter. It's open to retirees and spouses who are enrolled in our Choices Medical Plan. You are welcome and encouraged to enroll in the incentive program. If you are participating, you have the opportunity to earn points for wellness challenges, and that is on the platform. It shows us Pulse Cash that you can use to redeem for items in the Virgin Pulse store. You can also earn additional Pulse Cash by attending an MUS Well Check. You get additional Pulse Cash once per plan year. A quick update on Virgin Pulse. We wanted to share this information just in case you were to hear something or maybe see a Personify Health logo or something like that. Virgin Pulse actually merged with Health Comp in November of 2023. They're a large privately held independent third-party administrator, and Virgin Pulse and Health Comp together will be transitioning to Personify Health over the course of this current year. They will transition fully to Personify Health as of 1/1 of 2025. The Virgin Pulse Wellness Incentive Program and online platform are not changing at this time, but you will receive communications that will be sent out to eligible plan members announcing the merger in early December 2024. On to our Take Control Lifestyle Management Program. Again, this is for our non-Medicare retirees. If you choose to enroll and take control, it is confidential and voluntary, as all of our programs are. It is a comprehensive education and support program using telephonic delivery, which allows you to engage from anywhere and receive individual attention that is specific to your own needs. This program includes one-on-one monthly health coaching, telephonic sessions with licensed dietitians, exercise and sports science trainers, and certified diabetes educators. Again, we will continue to offer Wonder Health, which is a metabolic syndrome reversal program. This is offered via a digital behavioral counseling program. It includes 10 weeks of counseling that is personalized for skill building, 10 weeks of customized skill reinforcement, and 32 weeks of customized skill maintenance. It's weekly, self-paced, informative online video sessions, and it does include a mobile app, skill reinforcement, and habit formation. This program is provided at no cost to our medical plan enrollees over the age of 18. And I will point out, because we've had a few people inquire as to why they were told it was no cost, but then they may have seen an explanation of benefits that indicated the plan had paid. So the plan is paying for this on your behalf, but there is no charge to you. That is true of the Hinge Health Musculoskeletal program as well. This is a 12-week digital program which includes an unlimited one-on-one health coaching and personalized exercise therapy. This is for a myriad of musculoskeletal conditions, and it's delivered remotely using mobile and wearable technology. And again, this also is available at no cost to the medical plan enrollees over the age of 18. They do have exercises and coaching for a number of your joints, including your neck, your upper back, shoulders, elbows, forearms, wrists, and hands, lower back and hips, thighs and knees, shins and calves, and your ankles and your feet. So there really are some great opportunities. The people who have participated in the Hinge Health program have provided glowing positive feedback. So definitely a recommendation if you are experiencing any kind of musculoskeletal pain or ongoing conditions with regard to your joints. Just a reminder that Blue Cross Blue Shield of Montana has the Well on Target member portal. You can access this via BAM, which is Blue Access for Members. You do need to set up an account, but once you've done that, You can access the Well on Target portal. There's opportunity for you to take part in challenges, to track your fitness and nutrition. There are some journey recommendations for activities you can do that are based on how you responded to the health assessment. And you earn rewards for completing challenges, for doing some check-ins, for having your online tracker updated, or using your fitness device. So if you sync, say, a Fitbit or an Apple Watch or something like that, you'll also earn points for that. And then you can redeem those points for Well on Target in a store that you can access directly from the Well on Target member portal. If you have a certain level of items received through cashing in your points, you may receive a 1099. The IRS does have a limit at which point redeeming these rewards could be considered taxable. So for instance, if you saved up all of your blue points for 7 years and got an iPad and a room, something that would like heat your whole room in your upstairs of your house, you might have things that are over, say, a $600 value. Then you might expect to receive a 1099 that you would use when you file your taxes. Blue Cross Blue Shield also has a Blue 365 member discount program. You can go to their website and take advantage of types of items that are available for discounts just because you are a member of Blue Cross Blue Shield of Montana. So there's things like apparel and footwear, hearing and vision, nutrition, personal care items. So if you're interested, hop on and take a look at the discounts that are available for you by being a member of Blue Cross Blue Shield. And then Delta Dental continues to offer those enrolled in dental savings on both LASIK eye surgery and Amplifon hearing aids. So these are discount programs, and the way that you access them is by reaching out to either Amplifon if you're interested in their hearing aids, or to QualSight if you're interested in LASIK eye surgery. And then you can talk through how you find a provider, make an appointment, and receive your discount. So basically, there's an average savings on either the hearing aids or the eye surgery, and there is a nationwide network of providers. So you would call Amplifon or call QualSight, and you would either have a patient care advocate with Amplifon or a care manager at QualSight walk you through the program, what you need to do, and help you out with getting your provider and accessing your discounts. Okay, so on to actually enrolling in your coverage. You again will do that if you want to make any changes. You will contact your campus for an enrollment form, fill it out with the changes, and return it to your campus HR office by May 15th, end of business. If you do not want to make any changes, you do not need to do anything. Your benefits will automatically roll over, and they will be identical to what you have today. With regard to making payment for your retiree coverage, if that is not being done from a retirement plan, if you are directly paying, you can access that via the Benefitsolver platform. There is a place specifically for retirees for direct bill payments, so you would log in there. If it's your first time using this platform, you would need to create a username and password so that you have an account and register it. If you already have an account, you just enter your username, password, and hit the login button. Okay, there is a small change for those of you who are on retiree direct bill premium payments, and that is the due date change. Starting on July 1 for your July premium payments, we are changing to a premium prepayment schedule, which requires your premiums to be paid in advance. So direct bill statements will be generated on the 15th of the month prior to the month in which the premiums are due. Reminder notices will then be generated on the 1st of the month, and payments are due by the 10th of the current month. So for instance, for July, for direct bill, the statement will generate on June 15th. If payment has not been received, and it's not required to be, but if it's not received by July 1, there will be a reminder notice generated on July 1st, and then the payment is due by July 10th. This does not apply to those who are currently enrolled in online, automatic, or ACH payments, as those payments are already automatically processed by the 5th of the current month. So if you're already set up on automatic payments, you're already paying prior to the 10th of the month, so there will be no change for you. For those of you who use direct bill to make your monthly payments, you have 3 options. You can schedule automatic, recurring, or manual one-time payments online. You can schedule ACH transactions, and you would do that again in the Benefitsolver platform, or you can mail a physical coupon along with your check. If you are not currently enrolled, we strongly encourage you to consider enrolling in scheduled automatic recurring payments or ACH payment transactions from your checking or savings account. And this is for your convenience and to ensure that your premium payments are received timely. We just want to make sure that you don't end up being terminated for having late payments. And I know for some of you, there have been issues with the mail. We do look at, the dates that you send your payments in, but really the safest is probably to use an online, either scheduled payment or an ACH transaction from your checking or savings account. It's not a requirement. We've had some people ask if it's required. It is not. We're just saying that it's probably the safest to ensure that your payments are received timely. And that is all the information that we had for you today. So again, just a reminder, the annual enrollment period runs from the 24th of April, so 2 days from now, through May 15th. If you have any questions, please let us know. You're always welcome to call our team here in benefits in the commissioner's office. We've provided our number there. We really appreciate you taking the time to listen in today. And we hope that if you have questions, you reach out. And if not, that you just make sure if you want to make changes to your benefits, that you do it by May 15th, end of business. Thank you so much, everyone. Have a great afternoon.